All right, ladies and gents, thank you so much for coming to our presentation today. We're going to talk to you a little bit today about a system for taking a systematic review from pencil to publication. So these are the panelists that you have, the beautiful gentlemen you have standing in front of you here, Dr. Davis, Dr. Harrison, and Dr. Paxton. None of us have any significant disclosures. Dr. Harrison does have some research grants which are largely unrelated to this kind of presentation. Our objectives today are going to be to define systematic review, kind of appreciate the difference between a systematic review, a scoping review, a narrative review, and a meta-analysis, understand the best practices for conducting a systematic review, and then list 3 tips for writing and publishing a systematic review.
My turn?
Yeah.
I'll just use the one that's on. James Paxton, thanks for coming. So this says it all, right? Systematic reviews are hard, but that's why people respect them, listen to them, pay attention. So if you want to do something that is doable but a little challenging, this is a great choice. So what is the definition of a systematic review? It's a review that uses explicit systematic methods. The clue is in the name, right? Systematic methods to collate and synthesize findings of studies that address a clearly formulated question. All right, so one of the things you need to do before you perform your systematic review is to decide what is your clinical question that you want to address, right? And so why would I want to do such a difficult thing? I just said it's hard, right? It's hard to do. Why would you want to do such a thing? Well, this is the type of evidence that can inform clinical care, all right? Everybody says, if you're at all familiar with research, you'll hear people say repeatedly, randomized control trial, gold standard. RCT, RCT, RCT. When you look at the evidence pyramid, and I'm not saying you have to subscribe to that, but there's this pyramid that shows the level of evidence that people ascribe to different types of publications and studies. Guess what's right above RCTs? Systematic reviews. What's above that? Meta-analyses, right? So RCTs are great, but when you combine RCTs together, you get even better, right? And that's what a systematic review can do, in part. So I think it's research-based, it's reproducible, that's the systematic part, right? If you're doing it in a systematic way, someone else can come along next year and do the exact same review because you'll tell them how to do it, right? When you describe your methods. It's rigorous, that's the hard part, so you have to define your rules, your inclusions and exclusions, your search terms, everything up front, a priori, and then you follow through, all right? But because it's rigorous, it's also going to have reduced bias. And that's an important part of why a systematic review adds benefit to the literature, right? And we're bombarded with reviews all the time. They're not all systematic reviews. And even when they say they are, and you look at the methods, they're not systematic reviews, right? So be a critic of the literature and consider the benefits of doing this type of a study. They're well respected if they're done well, and it's important to know that as well. So I mentioned some of these concepts, some of these types of reviews, and I would argue, as I mentioned before, that a meta-analysis, systematic reviews are really strong level of evidence if done well, right? If they include the studies they're supposed to include, if they define their inclusion-exclusion criteria, if they search the right databases, and they provide all the evidence for how they did the study, they can be very well respected and provide a high level of evidence, all right? The problem sometimes is that we get confused on the terminology, right? So I mentioned sometimes things are called a systematic review and they're not. An example of something that might be mislabeled would be a narrative review, all right? And you're gonna see these all the time. In fact, there's journals that all they publish is narrative reviews. Or they call them invited reviews or expert opinion reviews, right? These reviews may still have value. Sure, they may have value, but you have to recognize that they're not a systematic review, that these are sometimes a person's opinion on what they should include or not include. And that increases the chance of bias. I would say probably guarantees bias, right? And also, unfortunately, reduces the level of evidence and how well you can rely on the results that they're providing in that review, all right? We're going to talk a little bit on this lecture about systematic reviews. That's the one that I'm saying is great, and I think you'll agree. When you hear how they're done and how they're done well, I hope that you'll agree it's an exercise worth undertaking. One of the things to remember when you're doing any project is you need to have a plan. How am I going to get this done? We're going to help you today, give you some tips, some ideas, how to organize your effort when you go to write that, work on that systematic review. This is how we suggest you approach it in these steps. And these are just defined steps in, I would say, a somewhat chronological order, right? The first thing to do, and I think this goes for any type of an academic scholarly query, is to define in, I would say, adequately precise terms, what is your research question? What do you want to know? What do you want to find out? This is a place where a lot of people fall down. Their question is too broad. Their question is not clinically relevant. Their question is just not a good question. So if you have all the methodology, if you know exactly what you're doing, but you pick a bad question, you're not going to get a good result, right? So start with the most important thing, in my opinion, which is picking a good clinical question. Then you got to build a team. So maybe you're not the person that's going to be qualified to do the meta-analysis that you want to put in with your systematic review. You want to combine the results from these other tests and do it in a rigorous manner that's reproducible and scientifically valid with low levels of bias, but you don't know the stats like that. Well, find somebody that does. Get them on board with you. Find a medical librarian that can help you track down these articles that you're going to need to review, right? Build your team. Write your research protocol. That's going to build on your research question. So what do I want to study? What do I want to find? I'm not saying you have to write a 30-page protocol here, but have a plan. How am I going to do this systematic review? Write that out so that not just you, but everybody on your team is going to understand exactly how you're going to do that review. And that includes a search strategy. So which databases are you going to use, right? And this is where having a medical librarian is amazingly helpful because they're frankly better at it than most clinicians are at searching these databases. They know the tricks, they know the things to watch out for, the pitfalls, right? So fine, if you know how to do it yourself. But if you're not sure, find someone that is sure, that knows how to do it. And I suggest a medical librarian if you have one at your institution. And there are software programs that can help your team work together. Covidence, for example, is a really great software program, freely available. It's Covidence, and you can go find that right now on Google. That software allows you to work with your team members, not just in uploading the articles that you want to review, but also in deciding yes, no. Are these included or excluded? If excluded, why? You can put reasons. You can actually tailor those for your team. So if you're doing a project that has specific types of exclusions, you can list those out. It makes it a lot easier for your team members to choose the right option. Then you're going to select your studies. So you've decided the scope, you've decided what I'm going to include in my systematic review. Then you got to go through and look at them, right? You got to look at these studies and figure out if they're relevant or not. Are they included or excluded from your review? You're going to extract the data. You're going to analyze the data, right? And that's where, again, some people are going to need help. That's okay. That's all right. These are often done by junior investigators, residents, sometimes med students, junior faculty. They might need help with the data, and that's fine. And then you're going to write the systematic review up. Again, maybe you need help with that too. I would definitely get whoever did the stats for you, your medical librarian, to help you with the methods section, right? And probably with the results section. And then hopefully you're going to get to add that to your CV, right? Because that's how you get advanced in life, in the career, is by getting advanced by having these publications. So how do you define a research question? I said earlier, I think this is one of the most important steps, if not the most important. This is the method I'd select. This is what I would recommend, PICO. So what that means is you're going to have these 4 criteria, 4 things you need to consider. How would you describe your desired patient population? That's the P, all right? How do you want to describe your population that you're going to study in this clinical question? I, what is the intervention or exposure that you want to look at? So not all studies have an intervention, but if they do, that would be the I, PICO.
The good news is it's PICO either way. So then it just becomes PECO.
So it could be an exposure. If you're not controlling that, if they weren't controlling that, it's still an exposure. C, what alternatives are you comparing to? What's the comparator, right? So you need to have a comparator in your question, in your clinical question. And what improvement or measurement would expect to be changed with the intervention? What's the outcome, right? That's the O. So if you remember these 4 letters, this acronym, it's very simple. It'll help you remember how to define a good clinical question. And if you have all 4 of these elements, then you probably have a pretty good clinical question. But I do recommend, before you get started on your review and you move into the steps these guys are going to talk about, ask somebody else for their opinion too, and get a couple people's opinions on your question to make sure that it's a valid question that people are going to be interested in reading about when you're done. So build that team. You know, if you have expertise in the area, you can be part of a team as a consultant to someone that's new. But if you don't have expertise, look for those people, that librarian, that consultant for data, or maybe just extra people to look through these articles, because maybe there's 1,000 articles you got to get through, and you need extra hands on deck. All right, so consider how large your study is going to be, what your needs are going to be, and who you're going to want on your team. So with that, I'll hand it off to talk about research protocol.
So we're going to talk a little bit. I do want to stress a little bit about having a great team, though. So a medical librarian, and it's great use of kind of trainees or research associates to kind of get, if you have 1,000 or 5,000 or 10,000 articles or titles that you have to review, it really is great to have a team and or a statistician. So the next step that we're going to talk about is kind of the research protocol. So like Dr. Paxton was saying, this is not a NIH grant submission. This is like a 1 or 2 page protocol that can be reproduced that's including kind of your objective, what's your search strategy going to be, which we're going to talk about in a little of the couple kind of details for that. Most important is what are your inclusion and exclusion criteria. So what are you including? Randomized trials? Are you including observational studies? Are you excluding, like what is your definition of a case report or a case series? Like if they have 10 patients, is that like what you're going to exclude, or is it 20, or is it 50? Particularly if you're doing kind of smaller kind of interventions that might have smaller studies included. And then important is what are your analysis methods. So we're talking specifically today about a systematic review and not all of the detailed statistics of a meta-analysis. There's a lot of people who spend their whole lives studying how to do meta-analysis and all the detailed intricacies of kind of different effect models and stuff. But what you want to do is upfront identify what your analysis method is going to be. And for systematic reviews, you don't necessarily have to have statistics in order to do that. And that doesn't have to be part of your plan, depending on what topic you're studying. So many topics I've written before, educational topics or things, some of the nursing kind of field as well. There's lots of instances where you might not plan to do a meta-analysis. That being said, that may be your plan up front as well, but even every good meta-analysis has to start with a well-done kind of systematic review. And then the last key is to have a protocol registration. So at the bottom there, you'll have a couple instances of places where you can register clinical trials or, systematic reviews and have them registered. So Prospero is probably the most well-known one. It's actually based out of the UK. And basically this puts your systematic review out there so that you have your protocol registered so that people can validate, just like clinicaltrials.gov, they can go back and validate that you actually followed your own protocol. But it also puts it out there so that somebody else doesn't like swoop in and take your idea while you're kind of working on doing it and maybe do it faster or do it not as well, and while you're trying to do a well-done one, and kind of stakes your claim on your idea as well and gives you a little bit of claim to that. So I would strongly recommend this, and this is something that I've historically not done and not been very good at, but after having done it most recently and a couple I'm going to continue to do. So let's talk a little bit about the search strategy. Obviously, Google is probably not the best search strategy, as you can probably tell from some of your patients who come in and tell you what's wrong with them based on what Google said. But some of the other ones that you may consider are listed here: PubMed, Ovid, Medline, Embase. What's important, again, is just to pre-identify which ones you're going to use. I would recommend using multiple databases. You will miss literature if you only use PubMed, and it's really not, it's a best practice when you do systematic reviews to have multiple databases. Again, if you have a librarian, they can really help you with this and kind of identify the search terms and for each database. So each database has a different kind of way that they use terminology and the way they use like the Boolean operators and stuff, which you'll see some of them here, but this is just an example of how one database does it. It's not all-inclusive, and it takes a lot of time to figure it all out by yourself. So again, that's where a librarian can be helpful. The other thing that's going to be really important to consider is what you're going to do with gray literature, and that's an important topic for systematic review. So gray literature are white papers, abstracts, presentations. Nowadays even, they're talking about, what do you do with a YouTube presentation of something or a TED Talk of something, and so it's just important to identify upfront what you're going to do with that and acknowledge that may or may not be a limitation, right? Like lots of research gets done and not published in academic papers in peer-reviewed journals. And you may decide that you only want peer-reviewed randomized controlled trials, and that's okay. But if you're doing kind of a niche topic, you may find that a lot of it's presented in an abstract form, and you'll miss out on a lot of important information if you don't have a plan to identify that. And there are databases that do that. None of them does it really well, and so again, it's just important to have a plan up front. This next slide is just an example of some of the kind of search strategies that I did on a previous kind of systematic review I did quite a while ago. And so you'll see that we did Ovid Medline, and we have the different kind of years that we searched them through and how many articles we got out of each one. And then this is like, for example, one of the many concepts that we did in this study. So basically we took this concept of handoff, we put all of the different keywords we could identify, and again, our medical librarian kind of helped us do that. And then kind of looking here, this is a different database that has another example of kind of the same thing going over it again. And so study selection, that's going to be an important, once you identify the database and the search strategies, you're going to get an output of 100, 500, 1,000, 10,000 studies. And you have to identify kind of this multi-step process of how you're going to go through them and identify them. The most effective way I found to do it is to use titles and abstracts as the initial screening thing. So when you get 10,000 articles, probably more than half of them, almost probably 3/4 of them, you can look at and be like, not relevant, not relevant, not relevant. And that's because your search strategy is designed to be overly sensitive and identify anything that could possibly be relevant at the expense of identifying a lot of things that are completely irrelevant. And the best way to do this is to have two independent reviewers looking at each title and each step along the way. So then once you've identified the title and the abstract, and you pull those articles that you think might be relevant, then you pull the full text of all of those articles and actually read all of the full text, and then decide if those are actually relevant. And then you go and then you can start synthesizing and getting your data abstraction using your pre-specified kind of inclusion and exclusion criteria. One important step here that I've forgotten before and has been very detrimental to me is make sure you record why you're excluding things at each step. That's an important part that they'll want to know for your publication. And if you don't do it, it is a real pain in the butt to go back and have to do it again for 10,000 articles that you already screened once to try and do it again. And then data extraction. So basically, once you've identified the articles that meet your criteria, you need to have a systematic kind of data extraction tool, what I like to call an abstraction tool. I always like to pilot test this with a couple articles and my abstractors, whoever I've trained to kind of do the abstraction, to make sure, A, that they understand the concepts, and B, that we're not missing anything. Because again, once you've extracted all the data and they've read through this study all in detail and they've read through 100 studies all in detail, it's really frustrating when you have to go back because you realize you're missing a data point and you have to go read through all 100 of them again to find this kind of one data point. So it's important to do that up front, to A, have your reviewers trained, B, to pilot test it and make sure that you've done it kind of on a couple articles to make sure you're not missing anything. And then most importantly, like I said, have two independent people do it. And that way, they can find things and discrepancies, and also you can have discussions whenever there's discrepancies about what data they used, because that'll highlight kind of maybe some discussion points you want to have, and then update it kind of along the way. Kind of it's an iterative process. So this is just an example of kind of one part of one abstraction tool that we did. I like to use Excel for this, but this is in one of our recent kind of publications. Basically, author year is basically a standard, and then you can look at kind of different things, what country it was in, what kind of methods they used, what their results were, and that all depends on what kind of study you're doing and what outcomes you're interested in.
All right, data analysis. So data analysis in the context of a systematic review and a meta-analysis means actually potentially a couple different things. I'm not going to go into too many of the stats details, but I think it's very important, more than anything else, to at least understand what the options are out there, because so much of this, as Josh alluded to, is if you don't consider the potential things that you can do and put them in your protocol first when you publish your protocol, you are at a very great risk of ending up with a lot of work for something that is either completely unpublishable or that at best you have to go back and redo all the work that you did. So, pop quiz, what's the difference between a systematic review and a meta-analysis? Someone just shout it out.
Studies in a meta-analysis have to have similar methodology.
Yeah, they do. Ideally, in a systematic review, they have similar methodology too, but in order to pool them, they have to, for a meta-analysis, they really have to be similar, because it gets at this idea of heterogeneity. So we talk about heterogeneity in a lot of different contexts, but in the terms of meta-analysis, if you're going to pool results from multiple studies to come up with one average result between the studies, you have to be very strongly certain, as you said, that all of these studies were done not just in the same way, on the same protocol, but really on the same population. And that part's really key. And I think the part that we really misunderstand the most is we say, well, they're all sepsis. Okay, but maybe one study was done in a surgical critical care unit, and one study was done in the ED, and one study was done, I don't know, in the CVICU at like a international transfer center for, LVADs. Like those are all different populations, even though they're all sepsis. So the biggest delineation that you have to know ahead of time is a possibility, is what you're gonna do if you find that there's a lot of heterogeneity between studies, because you don't know what studies you have until you do the systematic review. So you have to build into your protocol a contingency to say, okay, if by this measure of heterogeneity, they are this different, we are going to then do X. And there are lots of different X's in there and lots of different variations on it. And like Josh said, this is something that people have dedicated their careers to in studying from a methods perspective. But by and large, the one that you're going to find the broadest and most common sort of basic delineation is between whether you do a fixed effects or a mixed effects analysis for your meta-analysis. If you're familiar with those terms from regression modeling or other contexts, they do mean something analogous. It's not exactly one-to-one, but they more or less line up. And the idea is that if you have a little bit of heterogeneity, maybe you can use a mixed effects model to sort of overcome some of that. But ultimately, the goal is to have as little heterogeneity as possible, and that comes from building a good search strategy, having a focused research question. Other than that, data analysis is fairly straightforward for a lot of, especially interventional questions. It gets a lot more challenging for prognostic questions, for instance. So, for instance, one meta-analysis I did was with the Cochrane Heart group. And I was very interested in doing a very different question with them that was prognostic. And they said, we don't have anyone on staff. And that's Cochrane Heart. They're, a huge multinational organization. So it just goes back to the idea of, before you write your protocol, decide on your question and make sure you have the team, the statistician, librarian, and at least 2 people who are going to review every article, who are going to grade every article, who are going to assess for risk of bias, which can be done in a whole bunch of different ways, and that all of them agree that what you're proposing to do can be done, and that you've thought of, in particular, all these different contingencies, because, again, you don't know what you're going to get back. And a lot of times, you don't know if you're going to be able to do a meta-analysis. That's one thing you have to plan as well. So you might find that there's no literature. All right, so after that, writing things up is actually fairly straightforward, because it should, in theory, flow directly from your protocol. You should have had a firm protocol that outlined not just what you're going to do, but essentially that outlines exactly what you're going to write. Now, like Josh said and like James said, you want to have your experts, the medical librarian, the statistician, you want to have them writing those particularly technical parts because they understand the nuance there. But the overall structure of what you're going to write, this is in some ways the easiest part, and it will in some ways be the easiest publication that you'll ever write. Probably the most work you'll ever put into a publication overall, but the writing part is not that hard. All right, and then update your CV. All right, I think we're over time. I don't know if we can take a couple quick questions here.
Yeah,
I think we've probably got.
Yeah. Go ahead. I have one question. You mentioned, unexpected that you may end up with no literature actually your entire search that fits all your criteria. If you find, say you screen 1,000 articles and you find 1 or 2 or 0, do you go to that next step and write it up and provide that information to the community, or
Yes.
If it's sound and got library involved and done all the steps.
So I think there's actually, within that question is really two questions to which there's two answers. The first is, yes, you write it up no matter what, because kind of the beauty of a systematic review is that no matter what, if you go all the way through and you find that there are no high quality trials, because again, you're not just going through and seeing how much literature there is out there, you're also grading the quality of the studies in a systematic way. That's a really important contribution. I mean, assuming the question that you asked is something that's important, but say you asked, is there evidence for giving, I don't know. I'm going to get punched in the face for this one, but for giving ROGAM in the first trimester, for instance. And then you find, oh, there's not actually any randomized controlled trials for that. Yeah, that's kind of a big deal. That's actually a very important contribution to the medical literature because that's a call for future research.
The other thing you might consider is switching gears and looking at doing like a scoping review. So that's ideal when there's a huge gap in knowledge. And so if you've identified that there's a gap in knowledge and you don't mind taking a step back and redesigning your protocol a little bit, that could be a good way of using that information to produce something that's valuable, to define the boundaries of what's known without quite the same methodology as what a systematic review requires.
The other thing I would add too is it is important to realize when that happens and not just continue like pushing through with whatever you had planned, right? So that's how you end up with these garbage in, garbage out. And to be honest, it is very easy to do this wrong and still get it published. And you will see that done quite often. And so it's important to have the analytic skills to understand it. But it's also important, if you do get to that step, to not be like, hey, I have these two trials that were done on completely different populations. Let's meta-analyze them so we can get a single number so that and that will get published somewhere. And it's just garbage though. Like it doesn't mean anything. And anyone who has the ability will understand that. So yes, it's important to publish, particularly if it's well done on a good topic that people are kind of interested in. It is important to publish it and or kind of you said kind of shift gears to kind of a scoping review. That way you can do all the pathophysiologic reasons and what other kind of observational data we have and why it may or may not be indicated. And then you can finish with, we did a review and didn't find anything.
Well, and these are also, the other point I was going to make is these are all contingencies that you can and should build into your protocol. So you should have a specific contingency, and it is painful to write one of these protocols, but you should have a specific contingency. It says, okay, what are we going to do? What's the minimum number of studies that we're going to say is enough to pool the data or not? Like there should be a specific answer to that question that you have already come up with ahead of time. And at a certain point, it's somewhat arbitrary, but there is a lot of guidance out there. The one resource we didn't mention that I would highly recommend is the Cochrane collaboration has a handbook, which is really, handbook is underselling the voluminous nature of it. I mean, it is a compendium of myriad chapters that touches on right ways, wrong ways, and maybe slightly better ways and slightly worse ways, and everything in between for basically every single one of these questions. And there's a lot of other guidance out there too for this kind of thing.
I think we're out of time. Thanks everybody for coming.
Yeah, appreciate it.
Good job. Good job, guys. Yeah, good work.
And that's our contact information that's up on the board if anybody has any other further questions or wants any mentorship or guidance on any kind of projects that you're doing or collaboration. We're happy to answer any questions over email, and my Twitter's up there too.